back to EMS1 News Insider Analysis. Ed Bauter and Dan Schwester from the Overrun. Danny, today we have a story coming out of one of our close neighboring states in Connecticut.
Yeah.
So the town of New Britain, Connecticut instituted a Narcan training policy. And over the past year, they have found a significant decline, a 51% decline in opioid-related deaths. Now, before we get too far into it, the population of New Britain is about 75,000 people. And the changes that they saw was 43 deaths in 2023 down to 21 in 2024. So I do want to point out these are kind of small numbers, but it's a huge impact on the community of New Britain, where it took a little bit more time than they wanted to, but essentially they taught people how to administer Narcan. They focused on social services to try and decrease these opioid-related deaths. And it seems like they've had some success here, Dan.
Yeah, it's a very interesting program. The biggest thing that I noticed from this was not just the Narcan, but making EMTs empowered to be recovery coordinators and giving them the ability to refer to social services and addiction services and things like that. And we're seeing a real big change in this small town. And I think you could extrapolate it out to bigger towns if you did this. We're seeing this in our home state of New Jersey. We have liberal Narcan replacement rule regulations. All of our medic units and most of our EMS units carry Narcan for the patient who refuses transport. We do have follow-ups. And New Jersey, which has about 9.5 million, has been starting to see a drop in our opioid overdoses as well. I don't have the numbers at hand, but it just shows like we're treating it like a public health problem and we're starting to see the numbers go down, and we're not back to the bad old days where we had overdose after overdose and people just dying with I think these programs are necessary. I think they're good. They're good for the public. They're good for the community, and we need to be encouraging it.
Yeah, absolutely. And anecdotally, it feels like it's been a while since I've treated an overdose as well. It's just something that I feel like I've noticed. Yeah. But what's really exciting about this is that these are all grant funded programs that they have in Connecticut. And the way that it happened was, they got these funds, they got these ideas. COVID happened, which caused a really big problem for a lot of people, especially with opioid abuse problems. And so they got through COVID, but again, the important part here was they kept trying to work the program, right? They kept their grant funding and said, okay, we're going to refocus now that we're kind of out of COVID, that, we have a system that's somewhat back to the old normal. And they kept working that system. They kept trying to, encourage people to learn more about it. They kept working with Narcan leave behind programs. And it's a really good example of kind of how stick-to-itiveness to simple changes can improve this system. And now, and again, this is a small town, this is a small number, but knowing that we have this data, that's something that can be extrapolated into larger systems, right?
Sure.
We know that there's at least a little guy that kind of had a lot of success with this. All right, maybe your results in your system won't be a 51% decline. If you're working in an urban system, right, and you have 6 million patients, I'm not expecting that you'll see a 51% decline, but you might see a 30% decline, maybe a 20% decline. And the entire point of programs like this is to reduce recidivism and to reduce people that die from opiate use. That's what we're seeing in Connecticut. That's what we can see pretty much everywhere else.
Yeah, I agree. Isn't that better? They have 21 more people who are walking around, who are getting healthy, who are getting themselves off of these meds and becoming functional members of society. And isn't that what we need in this world today?
And that's not even talking about, like a ripple effect, the downstream effect of, there's plenty of, anecdotal stories of like, well, if you save one life, you save a million, all those kind of things. And there's nothing that can be said of fixing someone who's overdosed, allowing them to continue to live their life. You don't know what type of downstream effects those are going to have. Now, you can be a cynic and say, well, you don't know what bad things they might do either. But I tend to think that, having someone alive to make better decisions and, lead a better life and inspire other people is more important or more helpful than, what bad things people might do. We want to know what you guys think here on EMS1 News and Analysis. Check us out on YouTube and Spotify and everywhere else you get your podcasts. Check us out on TikTok as well. We have more EMS1 News and Insider Analysis stories here on EMS1. For EMS1, Ed Bauter and Dan Schwester from the Overrun. We'll talk to you guys next time.